Well, many of us have heard of spider veins or varicose veins before. And it's Florida, so it's almost short season all year long. So we always want to make sure our legs are looking and feeling their best. But what do we do if we think there's a condition that we have that might be a little more serious? And more importantly, where can we go for help? Well, today I'm here with Dr. Deacon Casey. We're here at Ponte Vedra Vein Institute in Ponte Vedra. Thank you so much for joining us today.
Of course, thank you for having me,
Absolutely.
Sadie.
Yeah, so it's a beautiful environment. It's a nice calming environment here. Beautiful, very much at the beach, which is great because I feel like when you're talking about vein issues and vein disease and things like that, it can be a little daunting. So having a nice calming environment with professionals is so important. So tell us a little bit about the Vein Institute and how long have you all been here and what conditions do you treat?
So, Sadie, I'm a board certified interventional radiologist, meaning that I work on the body, a vascular specialist using small little holes to get into the body. I've been working with venous insufficiency and vein disease for over 15 years.
Oh, wow. Okay.
And this location is about 6 years old. And for a lot of patients, when they're looking to find someone who can treat their venous insufficiency, we are the place to come to. We are vein specialists. We have a total combination of about 25 years of experience treating vein disease. So we are very well trained, well educated. What we do is that we aim to treat and educate patients so that they have all the tools and information that they need so that they can get the appropriate treatment as well.
Absolutely. It's so important. And speaking of education, I have to ask, so what is venous insufficiency? Because when I hear that, I may think, oh, am I not pumping enough blood through my veins through the body? Or could you tell us a little bit about that?
So chronic venous insufficiency deals with blood going in the wrong direction in your legs.
Oh, wow.
So basically the normal flow of blood is from your feet back up to your heart. So some of that blood will come back or trickle back down into your legs when you have abnormal valves. So over time your valves can be damaged or destroyed, and then those veins become larger and larger over time. Those veins can become ropey, they can become bulging along the surface of the skin, and those are actually varicose veins. So if you see any veins that are bulging on your legs, they're varicose veins. And then the other veins that you can see are spider veins, those thread-like little veins that you tend to see on the surface. They range from red, blue, purple sometimes. So we have all of the different modalities here to diagnose and treat venous insufficiency.
So important.
Absolutely. So we're well-trained, highly trained professionals who've been doing varicose vein and spider vein venous insufficiency treatment for over 25 years. So we know what we're doing. So if you're seeking a vein specialist to help you with your leg symptoms and your vein health, we aim to educate, and you'd like to come in to see us.
That's awesome. And I know we have PA Crystal Boatwright that we're going to ask some questions to in just a minute.
Absolutely. So Crystal has joined our team. She has over 10 years of experience treating venous insufficiency. So we have a team that's focused. We're passionate about vein health, and we're here to help you along the journey, to help you decrease the progression of venous insufficiency.
So now I am talking with Crystal Boatwright, a physician's assistant here at Ponte Vedra Vein Institute. Thanks so much for sitting down with us.
Thank you, Sadie, for taking time.
Absolutely. So I want to talk to you about varicose veins and spider veins, like symptoms and causes. Because when I came here, I was thinking, oh, I know what causes varicose and spider veins. And then I got here and I'm thinking, I don't know anything about what causes spider and varicose veins. So is it lifestyle? Is it genetics? Could you tell us a little bit about it?
That's a great question. So number one, genetics. So if anyone in your family has had varicose veins or spider veins, there's a good chance that you may develop it with time. Lifestyle, absolutely. So jobs that require you to sit or stand for prolonged periods of time when you're not engaging that calf muscle puts you at a higher chance as well. Being a woman, one of the great things, pregnancy, hormone changes. So there's a combination of things, but number one is we can't change who we are, so it's genetics.
Right. Well, that's so important. So it's important to identify it, and then symptoms. So what should we be looking out for in terms of how we feel, how our legs look and feel? What are some common symptoms of those?
Well, most patients will note that their legs feel heavy, achy, tired. You can have cramping at night. Restless legs is a huge one. Swelling that can develop with time. time besides just the appearance of varicose veins.
Okay.
And what we want to prevent is the disease progression. So over time, patients can actually develop skin changes to the lower legs and actually develop wounds. So this is more than just an aesthetic condition. It can cause a lot of long-term complications. And we want you to be the best you.
Absolutely. And we mentioned a little earlier, it's Florida, so we're always wearing shorts and stuff like that. So I think there is maybe a stigma, right? That it's like, oh, if I don't care how it looks, like the little spider veins or varicose veins, we don't need to worry so much about. But you're saying, no, we need to pay attention. We need to make sure that we come and seek treatment so they don't fester and become worse.
Absolutely.
Right?
That's our mission here. Dr. Casey and I, we've been doing veins for over 26 years together.
Wow. Yeah.
So we're passionate about educating not just patients, but the medical community, because it's a stigma that it's just an aesthetic condition, and it's not.
Right.
It can lead to complications.
So important. Well, thank you so much for talking with us today. Really appreciate your time.
Thank you. Appreciate it. Thank you.
Thanks. So what should we look for in a vein specialist, like having education from being able to treat varicose veins all the way to vein disease, and what's so special about your team?
Okay, so my team, as I said, we've done over 25 years of treating venous insufficiency, managing the disease, doing the diagnostic exam as well. So you need a comprehensive facility that can take care of the examination, just as evaluating your legs with the ultrasound,
right,
and then out to treatment, a place that has multiple different modalities that can treat your veins, such as endovenous radiofrequency ablation, endovenous laser ablation, as well as venous seal, Varithena, and sclerotherapy for spider vein treatment.
Wow, so many treatment options and so many things to think of. It's nice to know that there are experts in the field who can help us walk through those treatments and those conditions that we may have. So what's the best way for folks to contact you if they want to schedule an appointment? What's the best way to get in contact with Ponte Vedra Vein Institute?
So if you have venous insufficiency, any leg problems, or if you know anyone with that, you can give us a call at 904-280-0600. We do offer a complimentary vein screening here.
Awesome. Awesome. Well, thank you so much. Definitely, I'm sure viewers will take you up on that. And for more information or to watch this segment again, visit firstcoastliving.net.